think the things that interest me about COVID and its impact is generally what happens after any epidemic or any infectious diseases. Because quite often we tend to forget the mental health impact of people who have recovered and survivor guilt, people who have lost somebody, have not been able to say goodbye, and have not been able to grieve properly, and the impact of people who are frightened of getting an infection. I think one of the major issues about survivor guilt is it sort of makes you feel that either you deserved to live and therefore you are superior to everybody else, or you feel somehow that you should not have survived, whereas somebody who's maybe more deserving in your eyes died. We saw a bit of that after Ebola epidemic in Africa a few years ago, and there was quite a lot of coverage of what it does to people's functioning and living after they've come out of the infection. People have died in nursing homes, at homes, but rest of the family, because they're in self-isolation or otherwise have not been able to say goodbye, they've not been able to actually go to the funeral. So that does not bring about a sense of closure, which is incredibly important in dealing with grief. I have known cases where an individual has attempted suicide because they thought they had COVID. And that's a real tragedy. They survived. And, as it turned out that they were negative, but it does indicate what people will do under pressure. Economic downturn is an incredibly important factor, not only in rural parts of the world, but generally. There is evidence from the UK that in the last 10, 12 years, after the last economic downturn in 2008, rates of suicide among men have gone up. And also in rural areas, men are much more likely to use more violent means like guns. So part of the message has to be that we need to make sure that we remain in touch with our loved ones, no matter where they are, regular phone contact, regular FaceTime, Skype, emails, whatever, to try and make them feel that they're not isolated, they're not lonely, they're supported, they're loved, they're cared for. Big challenge in social isolation is that people are cooped up with each other 24 hours a day. If you're not allowed to go out, if you're not allowed to go shopping or to the pharmacy or go out for exercise. Consistently in the UK, there have been a splurge of advertisements for online gambling, which is likely to encourage people to gamble. If you're sitting there, you're bored, you pick up your phone, download the app, and you start to gamble. Similarly, child abuse and physical, domestic, interpersonal violence are likely to increase because there's, you may be in a small apartment, small flat, overcrowded, no access to green spaces. So you're likely to take it out on the person next to you. I think one of the ways of coping with social isolation is to have a structure to your day. Get up at the same time as you would have normally done, do the usual routines, exercise, you listen to music, you read, do things that give you pleasure. Whatever works for you, you need to make sure that you have time for that.